Now I'm in my patient's room. I'm going to introduce myself. So good morning, Sid. How are you today? I'm Zoe. I'll be your student nurse today. I'm here to administer your 6 o'clock dose of cefazolin to treat your infected wound. Is that okay? Okay, and can I just get your full name? Sid Garland. And your date of birth? 11/08/65. Okay, do I just see your wristband? Sid Garland, 11/08/1965, 11/08/1965. MRN 344316, 344316. Okay, that's great, Sid. And do you have any allergies today? Codeine and penicillin. Okay. The wristband says codeine and penicillin. Okay, that's great. And do you have a history of reaction with these medications? Okay, thank you. Okay, now that we're done that, I'm just going to bring this out of the way. And I'm going to make sure my main regulating clamp is closed. Now I'm going to swab the port with an alcohol swab. Before attaching my secondary set. And now I'm going to open clamp to back prime. And I'm just going to let it fill halfway. Okay. And now I'm going to hang up my medication. And I'm going to lower my main IV line. Okay. So now I am going to regulate my secondary line to a rate of 33 drops per minute using the main regulating clamp. So now I'm going to just show the drip rate for 30 seconds. Okay. And now at this point, I would provide my patient with health teaching. So Sid, it is important to report signs of rash, fever, or diarrhea to your nurse or your healthcare provider. And it is also important to not treat diarrhea without consulting a healthcare professional should you have a side effect of diarrhea. It is important to tell your nurse beforehand before trying to treat it. Okay, so at this point, I would come back in about 10-15 minutes. Since it is a rapid onset medication, I would be assessing for any signs of reaction, such as like hot rash, and I would also take the patient's vitals after this time just to make sure that the patient is not having a reaction or any side effects of the medication. So now I'm going to leave my patient comfortable and safe, and then I'm going to head back to document on the MAR. So now I'm going to document on the MAR, so I'm going to put the date, so I put my initials, I left room for a co-signature, and then I put the site, which is the left hand. So at this point, I would obtain a nurse's co-signature to sign my MAR, and then I would be finished my critique. Thank you.